My name is Gaby and I am the Domestic and Family Violence Coordinator here for the Sunshine Coast Hospital and Health Service. So Domestic and Family Violence Prevention Month occurs every year. With this month we're looking at coercive controls, and one of the things we're trying to highlight is that sometimes violence doesn't have any type of physical aspect, so we can be looking at financial control, isolation, emotional abuse, verbal abuse, controlling how people are, their right to autonomy, and their ability to be their own person. So one of the things is, I guess, when you're looking at domestic and family violence, is not wanting to just focus on the physical aspect, because those are the ones that we can see, but underneath there's all these other power and control and abuse that is happening, and that's where I guess this month really looks at wanting to highlight that. So there's a lot of resources available for one, if you're experiencing domestic family violence, or if your family members or friends are experiencing it as well. Here on the Sunshine Coast we do have a particular website called the Domestic and Family Violence Coordination Team, and what that is, it's run through IFYS, but it lists all the localised DFV services. You've got the DV Connect, have an app called Daisy, which has a lot of support as well, and more recently the Be There app that has a lot of information of how you can be supporting your family and friends that are experiencing domestic and family violence. So one of the things that we have here at the Sunshine Coast Hospital and Health Service with the Domestic and Family Violence Coordinator that I'm in is that role is overseeing the policies and procedures and looking at training. One of the things that we've identified is that we can train up staff, but then there is no linkage between presentations that are coming through our hospital and health service and then a linkage into the community. So what we are hoping to do is raise money for a domestic and family violence social worker, and part of their role is going to be able to be that linkage between the hospital and the community, and making sure that those referrals go through, making sure that people aren't lost between the gaps. Your donations help Wishlist to fund positions like the domestic and family violence social work role. That through that role we're able to gather data and research that then will be able to provide advocacy for these roles to become permanent within the health service and benefit the community, which therefore benefit victim survivors here on the Sunshine Coast.